When it comes to ME, chronic fatigue syndrome, there's always going to be some doubters out there about whether it's a proper disease or if it's just all in your head. Yesterday on one of my videos, I had this reply put onto it in the chat. Now, unfortunately, when it comes to social media, there's always going to be someone who thinks that they know something different to what you know. There's always going to be an ignoramus. But the person that commented basically said that it's depression and anxiety and that needs to be addressed. Well, yeah, doesn't any form of depression or anxiety need dealing with? Depression and anxiety can be as the result of a life-changing event. It can be down to having illness, it can be down to money issues or any other type of things. Now, when it comes to treatment for those things, they actually can be dealt with by exercise, talking therapies, medications that actually help with the levels of chemicals in the brain. And normally once the cause of the depression and anxiety has been addressed, it's over. Now, ME, CFS is completely different. It's actually known as a complex multi-system neurophysical disease. With ME, there are a lot of symptoms to deal with. Brain fog, pain that varies all the time, muscle weakness, muscle cramps, joint pain, unrefreshing sleep, and the main one with ME is actually called post-exertional malaise. Now, what that is that when the person overexerts themselves, it follows into a crash and a flare-up of symptoms. Now, when we say overexert ourselves, it can be something as simple as getting up out of bed one day, hearing some music, cleaning the house, and it will make some symptoms flare up and it can put you in bed for days or weeks. Now, unfortunately, there isn't some magical medication that can actually help you get up out of bed. It's not like you can take Viagra and it's going to erect you out of bed. So treatment-wise for ME is a number of things. A lot of people tend to use pregabalin, which helps with the muscle spasms and muscle twitches, along with the nerve pain that comes along with it. And people might be on some strong painkillers, opioids such as codeine. For a lot of chronic conditions out there, you exercise, it does make you feel better. When it comes to ME, it's actually dangerous. It can make you overexert yourselves and you're into a crash. It's not unheard of that people that overexert themselves and go to the gym just to make yourself feel better actually end up in a crash so severe that they end up in hospital. And the big thing with ME is that there is no cure. Now, when it comes to the self-diagnosis comment, that was a pretty silly comment. ME cannot be self-diagnosed. For instance, to have ME, you must have the symptoms for more than 6 months. All of the conditions must be ruled out, which means that you have to go for various scans, you have to go for blood tests, physical tests. You go to see if you're suffering from depression or anxiety. But it must normally be a GP, a rheumatologist, neurologist, or a doctor who specializes in the field of ME who actually diagnoses you as having ME. If you've got ME, you might get depressed, and yes, it is going to help you if you do have it treated, but it is not the cause of ME. Now, who's to say that some well-mindedness thinking isn't going to help with the symptoms, but actually sitting around singing Kumbaya isn't going to cure it? Thanks, hope it helps.